This last week, the major health insurance companies that serve the state of Illinois announced projected dramatic increases in health insurance premiums for next year. And when the executives of these insurance companies were asked why, they said, number one, the uncertainty in Washington. We don't know what's going to happen. Number two, the promised payments by the federal government to these health insurance companies that are taking on special responsibilities of people who are older and sicker and more expensive. And number three, we want to know what America's future is going to look like when it comes to health care. If you can't give us the answers to that, then we're going to raise our premiums to the point where we cover the possibilities, and some of them are grave and serious. So the responsibility we face in Washington is to get this job done. The problem we have is not just the complexity of the system, but the problem we have is the White House. We have statements being made by the president on a regular basis, being tweeted and the like, and these statements basically are saying that he believes we should let the healthcare system disintegrate to the point where, in his words, the Democrats will come crawling, begging to repeal the Affordable Care Act. Well, I can tell the president the obvious. It isn't just the Democrats that will be suffering mentally. It will be people across America who will suffer if our healthcare system starts to disintegrate. We need to do our work in Washington on a bipartisan basis to make this healthcare system work. I believe in the Affordable Care Act. It has cut the number of uninsured in half, but we need to do more to strengthen it and to address those areas of weakness currently in the law. We need to do it together. The American people expect nothing less. And we need to say to President Trump, work with us, not against us. Don't sabotage this system. Join us in saving this system. We don't want to have victims across America who don't have health insurance in critical moments in their lives, and people who can't afford the premiums for health insurance that they buy on the exchanges. We need the White House to be on our side, not against us.